Hi, I'm Dr. Ramya Sridharan. I'm a consultant obstetrician and gynecologist in Motherhood Hospitals. Today I would like to talk about polycystic ovarian syndrome or disorder. This is a problem which is faced very commonly in women nowadays, which is why I thought I would address this condition more than any other condition. Now, this is a condition where women develop a lot of menstrual irregularities, like either they don't have any periods or they develop irregular, like they develop periods every 2 to 3 months, or sometimes there is excessive bleeding, and patient is obese and they have a lot of hair growth, like upper lip hair growth or hair under the umbilical area, and a lot of acne. And most common reason to be diagnosed as polycystic ovarian syndrome is the ultrasound. So, this polycystic ovarian syndrome, why is it so common nowadays is that it is totally based upon our lifestyle changes. So, women as per our evolutionary changes, we are supposed to do a lot of physical exercise and work, but nowadays we don't seem to be doing that, and we have taken up the men's role of doing a table chair job. So, which is why our physical activity level has come down, and this has resulted in a lot of menstrual irregularities and polycystic ovarian syndrome. So, which is why if you ask your grandmother or your mother, I don't think you would have even heard one or two patients saying polycystic ovary syndrome, but now every third patient who walks into my clinic seems to be having polycystic ovary. So, now if you look at what are the complications which can happen in a polycystic ovary, either there is a high chance of there is a lot of insulin resistance. Because of that, there is diabetes, there is a risk of diabetes, and there is hypercholesterolemia, wherein the patient may become hypertensive. And because of the irregular periods and the myth that you're not supposed to take any tablets, patients don't take any withdrawal, don't take tablets to get a withdrawal bleed. Because of that, there is an endometrial hyperplasia, and later on in 50 years they can develop endometrial cancers. So, these are the problems which complications which can happen later on, which is why polycystic ovary syndrome has to be addressed now and not later. So, if you look at the age group, we are seeing all age groups developing polycystic ovary. Now, if you see a young school going or adolescent age group, the main requirement is for her to get her periods regularly. We don't need to unnecessarily medicate this child or load the child with hormone medicines. All we need to do is teach them that if they don't get their periods more than 45 days, just take a 5-day progesterone tablet and get the withdrawal. That's it. Now, there are lots of times where they are given 21-day pill and all those things, which is totally unnecessary because the level of estrogen in the body is already high, and we don't need to unnecessarily give them 21-day pill, which is a estrogen progesterone pill. And more than anything, the first treatment, the line of treatment is change in the basic dietary habits and lifestyle modification, which is the first and most important treatment protocol. So, if we have found that, I mean, it is documented that if you lose 5% of your body weight, so there is 70% chance of having ovulation. So, and there is only a 30% of the patients do not ovulate in spite of all this. So, when 70% can ovulate just by weight loss and exercise, why not do that rather than come initially for medications. So, if that is still not happening and you're even in spite of your exercise and weight loss and your periods are not coming, then you can always take this 5-day progesterone pill and get your withdrawal, which has to be again given by a gynecologist and not the over-the-counter prescriptions. Now, if you go to a person who doesn't have either there's a history of infertility, then the treatment is totally different, where they have to go to a gynecologist, get themselves investigated, and if it is only a polycystic ovary, then you need to get medications for ovulation induction, because the basic problem in PCOS is there is no ovulation. So, once a doctor gives you a prescription for medicine to ovulate and ultrasound wise it is monitored, then there is a good chance of pregnancy. If the patient is in the later age group 30 to 40, then again and they want contraception, then the ideal would be to give them any low dose pills or other kinds of intrauterine devices. But if you take a patient whose basic problem is only a menstrual irregularity, again the same 45-day rule of not getting a period, they can always do a urine test, rule out a pregnancy and take a progesterone to get their withdrawal. So why do we wait? Why do we say this 45 days? Because when you do the lifestyle changes and weight loss modifications, there is a high chance for you to ovulate within the 45 days. If you don't ovulate within the if you don't get your periods within the 45 day, then you can always take the progesterone. So you also know we give chance for your body to also work normally, and if it is working and you get your periods, you don't need to unnecessarily take medications. This is a principle.